I got it.
Hello, everyone. My name is Sarah Hayes, and this is my video recording for CHPM 2605 Practice Development. First, I'm going to show you a little bit about my binders. This is my new practice binder. In this, I have a pre-visit form, which is kind of a patient history form, kind of a background about their life, everything like that. And then I have a visit 1 section, which is all about the first visit. What will happen when the new patient comes into the office, what kind of care they'll receive, a basic outline. I also have a healthcare class section, which is a schedule of all the healthcare classes that we offer in the office and kind of what those healthcare classes are about. It gives them a little ticket if they want to invite someone else. And then I have a report of findings section. In this, I have something that kind of shows the patient on the spine where their focus is on, as well as how often they'll come in for care and kind of a care plan. And then I also have a progression exam, which will take place about every month or at every end of phase of care for the patient. And then I also have a research binder, this one. In my research binder, I have a vertebral subluxation section, a wellness development care section, chiropractic spinal care, subluxation condition-based care, functional neurology and chiropractic, and current relevance. Okay. And first I'm going to start with an office visit at my office in Saskatoon, Canada. Hello, I'm Dr. Sarah Hayes. Nice to meet you.
Nice to meet you.
What's your name?
Madison.
I'm very excited you chose chiropractic today. I first want to start by finding out what brought you into chiropractic care, and I want to make sure you're a good candidate through the services at my practice.
Okay.
So what brought you here?
Well, I had a sick hockey game with my brothers on the pond in the backyard.
Oh, fun.
And I was just skating along, and my brother tripped me, and I fell right on my back and my hip right around here.
Okay.
And so it's just been hurting, so I thought maybe I would come here instead of do drugs.
Oh, like what type of drugs do you mean?
Just Advil and
Oh,
like the normal stuff, not any hard drugs, just regular ones.
okay. And when did this pain start? When did this incident occur?
What did I say earlier? Like a week ago, probably.
A week
or
ago?
couple days, like 5 to 7 days ago.
Was it worse in the beginning? Is it getting better? Or is it getting worse, do you think?
Just worse.
Worse every day? Is it worse in the morning or at night?
More in the morning.
In the morning, okay. On a scale of 1 to 10, how bad would you say it is in the morning?
Like a 7.
What about at night when you go to bed?
Like a 7.
Okay, is there anything that makes it better?
Advil and ice. And some hot chocolate.
Oh, always. That does the trick, always.
Yeah, Saskatoon.
Is there anything that makes it worse?
Walking?
Okay. Yeah, that could be a sacrotuberous ligament issue.
Yeah.
Okay, does this pain affect your everyday life?
Oh, yeah, I have to walk to get anywhere.
Oh, okay. And have you ever seen any other healthcare providers since you've received this pain?
No.
Awesome. Well, I'm glad you chose our office first.
Yeah. My mom was technically first, but yeah, you guys were first too.
Okay. Well, from what I can see, I think that we can definitely help you with the pain that you're feeling on your left hip and kind of that whole region. And I think that you'd be a great candidate for chiropractic care. So I'm going to tell you what we're going to do today.
Oh. Sorry.
Okay. First, we're going to be doing a family history, and I'm going to take your x-rays to make sure I can understand the problem, make sure there's nothing too serious going on. I just want to make sure you're perfectly suitable for chiropractic care. How does that sound?
Sounds good. Let's get going.
Okay. For your family history, I'm going to ask you to answer to the best of your ability. You can tell me anything you feel is necessary, leave out anything you feel is don't. Some conditions can be genetic, so it's always important to get a good family history.
Okay.
And our techniques will be geared towards you and the condition presented, so this is how we can get your body back to optimal functioning as quickly as possible, okay?
Okay. Yep.
Okay. And then after that, we're going to take some x-rays.
Okay.
I x-ray almost every single patient when they come in after an incident like this, just because the trauma that you go through is so intense, and I want to be able, I can give the most specific adjustment possible to benefit you.
Mm-hmm.
And then I just want to be able to assess your overall spinal well-being in those x-rays, so I'll take a full body x-ray we'll do for your cervicals and your upper neck all the way down to your hip bone.
Okay.
Okay?
Mm-hmm.
And in just a moment, my CA is going to come get you and take you to the room where you can just go ahead and get your x-rays done, okay?
Okay.
And before that happens, I just want to let you know I may not adjust you today because I just want to make sure I have enough time to assess the information. I want to give you time to sleep on it, make sure this is really what you want. I think you're a great candidate, and feel confident. I'll see you back soon. But I do want to let you know that first, okay?
Okay, well, can I take my drugs in one more time?
If you feel like you need those, yeah, definitely. But I will say, I think you're not going to be on those for very long.
Alright, okay, just wondering.
Okay. Alright. I'll see you in just a minute.
Okay.
Okay.
And begin.
Welcome back, Madison. How are you?
I'm doing dandy. How are you?
Good. Today I just want to go over your reported findings, and I'm going to go ahead and then give you your first adjustment if you still want to do that and get you back to feeling healthy.
Sounds good, as long as I can play hockey.
Oh yeah, you're going to be playing hockey with your brother soon.
Alright.
Okay, so in the reported findings, I want to show you your x-rays and kind of what I found.
Okay.
You see, your spine looks very healthy for the most part. A little subluxated probably, but nothing we can't fix after a few adjustments. We're going to get you feeling healthy.
Alright.
And then here's your hip. You see how your pelvis is a little higher on this side?
Yep.
That's what we call an AS listing. And then I've noticed when you're walking, you've kind of been walking with the toe out flare. This is what we call an IN listing. So you'd have an ASIN listing.
Sounds
Okay.
fancy.
And so what I think, yeah. What I think we're going to do is go on a treatment care plan.
Okay. I was wondering where we were going there.
Yeah. I'd like to see you 2 times a week for about 6 weeks.
Okay.
Usually patients respond best to this, I've noticed. Does that sound okay to you?
My mom's paying for it, so that's good.
Okay, cool. And so by following this treatment plan, we should be able to see how your vitals, x-rays, and overall health are progressing, and then we'll reevaluate probably before those 6 weeks are even over, and maybe at 3 weeks with small reevaluation.
Mm-hmm.
Yeah, do you have any questions so far?
Nope, I don't think so. I had to think for a second. No, I don't think so.
Okay. So we're going to go ahead and start with the condition state of wellness. As a condition-based care patient, we require you to come in through a healthcare chiropractic meeting with us once a month.
Mm-hmm.
Do you think you'd be able to make it next Tuesday?
Yep.
Perfect. You could even bring your brothers. You know, they're playing hockey. I'm sure chiropractic might be great for them, too. You can bring your mom, your dad, any friends, anyone you want. Bring
How
them all.
many tickets do I get?
I'll start with giving... Do you have a lot of friends?
Yeah.
Big family?
Oh, yeah.
Okay, I'll start with 10, and then you just come back, and you can get as many
Keep
more
coming?
as you want. Yeah.
Just keep coming?
You hand them out.
Keep
I want
coming,
to
okay.
see them all.
Alright.
Perfect. And at those meetings, we cover things like nutrition, exercise, stretches, just daily things you can do, like lifestyle habits, sleeping, everything to just kind of help improve your
Everything
care.
under the sun and
Yeah.
more.
Oh, yeah. We just want to make sure you really get the best care possible in our office.
Mm-hmm.
So, yeah.
Great.
It's just going to be 1 hour.
Okay.
So that's nice. In and out. There will be some snacks.
In and out quick.
I know everyone loves snacks.
And good snacks. Cheese? Any cheese?
Yeah, we could do cheese. You like cheese?
Yep.
Perfect.
Okay.
Okay, yeah, we just want to help you spread the message to as many people as we can, and I hope that you're a good message relayer.
I
Or
am
chiropractic.
great at message relaying. Good thing.
Okay,
I used to be a cheerleader. I used to be able to relay a lot of messages.
cool.
Okay.
Welcome back, Madison. It's been 6 weeks. 6
Oh,
weeks,
yeah.
wow, since I saw you last. How have you
Since
been?
you saw me last?
Well, since we started care.
Okay.
I mean, you know, I see you twice a week.
Yeah. Been great. Been back out on the ice, clinking some pucks around.
Yeah, how are you feeling?
Great. Been jiving my brothers back and forth.
Oh, cool. Okay, so today I just want to give you a little reevaluation. I'm going to have you fill it out. Just kind of tell us how you've been. How's your pain feeling? I remember the first time you came in, you said a 7 out of 10 every morning.
Great.
How
2.
about 2? Okay.
Zero.
No,
Zero.
2's okay. We're going to get you to 0, though. That's what we need to do. I think we can even probably mark down the care, but we'll see how this little survey goes out.
Yep.
Okay? And in this survey, the first part is just how your care has been. Then I want you to give me anything you think I could do better or worse.
Okay.
Anything else you'd like to see in the office. How you think the CA's been doing, the massage therapist. I know you saw him a few times. Said you liked him. Any changes that you feel could just be better for the office morale. And then at the end, if you have anyone you'd like to refer to chiropractic, I'd greatly appreciate that. I think that from what I've seen, you seem to be doing a lot better, so I hope you can tell everyone else.
A lot better. I tell everyone. I even Facebook share it all over.
Thank you, Madison.
World
I really
Wide
appreciate
Web.
that. Oh, yeah. That internet's something crazy, huh?
Yep.
Okay. Well, thank you, Madison.
Okay.
I'm hoping I can help all the people of Saskatoon, Canada.
Make us proud.
Yeah, in order
Yep.
to do this, I'm
Okay.
going to need more patients just like you.
Uh-huh.
Okay. Lucy. Here I have my research binder. In my research binder, under my vertebral subluxation binder, I have an article about health outcomes following cervical specific protocol in 300 patients with many errors followed over 6 years. I found this very interesting. The patients were analyzed and upper cervical listings were determined using the Blair X-ray analysis method. 90% of patients had a PI atlas on the opposite side of the affected ear. And I find this extremely interesting because my mom actually has Meniere's disease. And when the patients were in pattern, they were adjusted using the toggle recoil technique or pierced results knife edge. And after 6 weeks, the average rating of vertigo dropped from 8.5 to 3, which is a huge difference. And then I have my wellness development section. For this section, I found an article about the health promotion prevention practice in chiropractic and how teaching in an outpatient clinic can reflect an active wellness and lifestyle. And in this study, 100 patients were randomly selected. And of the patients that were obese, 73% received advice on diet and nutrition and 80% received advice on exercise. But only 8% received advice on healthy weight management, which I thought to be very odd considering how high the numbers are and why the weight management section was so low. But this study shows that there is a huge need in the way that we approach wellness development in the future, and I think chiropractic can help be a huge stepping stone for that. And then, in terms of chiropractic spinal care, I found that an article about correction of cerebral kyphosis of health concerns, Fulham's and a certain adjustment utilizing the Pierce chiropractic technique to report insurance of cervical kyphosis. And that I found was just a huge research about the ability of chiropractic care and how to help the spine. Okay, and then I have subluxation condition-based care article, and this found that the resolution of chronic fibromyalgia, improvement of spinal curves following correction of the atlas subluxation. So this one's kind of similar to that first one we talked about with Meniere's disease. And in this article, we saw how they evaluated the effect of knee, chest, upper cervical chiropractic care on 32-year-old female patient with fibromyalgia syndrome and concurrent symptoms. And this patient saw huge improvements in her everyday functioning, as well as the symptoms that come along with fibromyalgia. And then I also found an article about functional neurology in chiropractic, And this article was the resolution of ataxia in a pediatric patient undergoing subluxation-based chiropractic care, and it was actually a case study research. And in this, a 7-year-old female presented with ataxia stemming from a transneuronal dysfunction in the right cerebellum. And after only 4 visits to chiropractic office and receiving a high-velocity, low-amplitude adjustment, such as toggle, to the affected areas, the child had marked improvement in gait pattern and ataxia. So actually they saw huge differences in her physical tests that they performed in the office. And then I also found an article about current prevalence of chiropractic and about the new vitalistic-based healthcare system that's coming up and how it's becoming so much more based on wellness rather than treating certain symptoms of pain. And it had a positive concept of healthcare interviews with patients of practitioners in an integrative medicine clinic. And in this, they conducted interviews with patients and practitioners who kind of talked about the understanding of health, what health is to them, and how it's more of just not having a disease. It's about the wellness and how they can improve their everyday functioning through things such as what they're eating and chiropractic care and just being active. And that's the end of my video.